Hello, and welcome. Today, we're going to break down a topic that's really important and affects so many of us and our loved ones, breast cancer. Now, I know it can sound complicated and even a little scary, but stick with me. We're going to make it all make sense. Welcome to Smart Stuff. It's so good to have you here. This is where we take big topics and make them simple. Because honestly, knowledge is power, right? So let's get empowered together. All right, so here's our game plan for today. We're going to cover 5 main things. We'll start with the basics. What even is breast cancer? Then we'll get into the different types because they're not all the same. We'll talk about signs and risk factors, how doctors figure it all out, and finally, the different ways it's treated today. Simple. Okay, first things first. When people say breast cancer, what are we actually talking about? To really get it, we have to start with the basics of how the body is set up. You might hear doctors use this big, fancy term, malignant neoplasm. Don't let it worry you. It's just the medical way of saying a cancerous growth that starts in the breast. And look at that statistic. It's the second leading cause of cancer death in women. That right there tells you why this conversation is so important. So to understand where things can go wrong, let's quickly look at the breast itself. Just imagine a tree, okay? The lobules are like the leaves. They're the little glands that make milk. And the ducts, those are the branches that carry the milk. All of this sits on top of your chest muscle. But here's the really crucial part. The breast has this drainage system. And that brings us to this number, 75%. This is a big deal. It means 3/4 of the lymph fluid from the breast drains into the lymph nodes under your arm. Think of those lymph channels as a highway system running through your body. If cancer cells get onto that highway, they can travel. And that is exactly why a proper breast exam always includes checking the armpit. So we know where it starts, but what does it look like? You see, it's so important to understand that breast cancer is not just one single disease. There are different types, and knowing which type someone has is absolutely key to getting them the right treatment. So the first big split is between in situ and invasive. In situ literally just means in its original place. The cancer cells are there, but they're contained, They haven't broken out. But invasive means they have broken through the wall of the duct or lobule. They're on the move, and that's when things get more serious because they can now spread. And when we talk about those invasive cancers, this chart shows you that one type is by far the most common. A huge 75% of them start in the milk ducts and then break out. That's why you hear the term infiltrating ductal carcinoma so often. It's simply the most frequent kind. Okay, now this part is really cool, actually. Imagine that cancer cells have little docking stations on their surface. These are called receptors. Some cancers have receptors for hormones like estrogen, which they use as fuel to grow. The good news is we can block those receptors and basically starve the cancer. But then you have triple-negative cancer. This type doesn't have any of those 3 main receptors, which makes it trickier because those targeted drugs have nothing to lock onto. So now that we've covered the science bit, let's get really practical. What are the signs we should be looking out for? And what are some of the factors that might increase someone's risk? Everyone knows about finding a lump, and that's definitely a major sign. But it's not the only one. You have to pay attention to skin changes too, like dimpling or a weird texture some people call peau d'orange because it looks like the skin of an orange, or if a nipple suddenly turns inward or there's discharge. But here's the most important thing I can tell you. Screenings can often find cancer long before any of these signs ever show up. So what puts someone at a higher risk? Well, a small percentage, about 5 to 10%, is tied to genes that are passed down, like BRCA1 and 2. Other things play a role too, like lifestyle factors and just simply getting older. But please, hear me on this. Having a risk factor does not, I repeat, does not mean you will get cancer. It's just one part of a much bigger picture. So, what happens when there's a worry, a lump, a strange symptom, or something shows up on a screening? How did doctors go from, what's this, to a definite answer? Well, that's the diagnostic process. For so many people, the whole journey starts right here with a routine screening mammogram. And this is just so powerful because a mammogram can spot tiny changes, sometimes years before a lump could ever be felt. This is what we mean when we talk about the magic of early detection. Now, if there is a specific concern, doctors have this amazing tool called the triple test. It's a 3-part process. First, a physical exam by the doctor. Second, imaging like an ultrasound or another mammogram to get a good look inside. And third, if needed, a biopsy, where they take a tiny piece of tissue to check in the lab. When used together, these 3 steps are almost 100% accurate. It's how they get a clear answer. And once you have that clear answer, it leads us to our last section, treatment. And the most important thing to know about breast cancer treatment today is that it is not one size fits all. It's personal. Generally, treatment is built on 3 main pillars. You've got surgery to physically take the cancer out. Then you've got radiation, which uses high-energy beams to zap any leftover cancer cells in that area. And finally, there's systemic therapy. These are drugs that travel through your whole body to fight any cancer cells that might have spread. And hey, remember those docking stations, the receptors we talked about? This is where that information becomes a superpower for doctors. If the cancer is fueled by hormones, they use therapy to cut off the fuel. If it has that HER2 protein, they use drugs that target it specifically. For others, chemotherapy is still a very powerful option. The treatment is always matched to the cancer's unique biology. It's so smart. Honestly, this quote says it all. Multidisciplinary means you have a whole team, surgeons, oncologists, radiologists, all working together for you. And individualized means the plan is built not just for the cancer, but for the person, for their life, their health, their goals. That's how it should be. Wow, we have covered so much ground today. But knowledge isn't meant to just sit in our heads, is it? It's meant to be used, to be shared. So the real question I want to leave you with is this. How can you take what you've learned here today and use it to start an important, maybe even life-saving, conversation with the people you love? Thank you so much for joining us on Smart Stuff. Stay safe.